Okay, so we're going to go ahead and get started. So the first, we're going to do the first section, and I'm going to do as I typically do. I have them kind of grouped into a couple of different topics, and in the first section I just mostly want to talk about prevention, caries, and a little bit about thumb sucking and pacifier sucking. So the first questions, question 1 and 10, and I'm going to read them out for the students that didn't see these yet. Most of them are pretty simple as far as how much writing there is. So the first question is, of the following, the feeding practice that would be most likely to cause severe caries of the upper incisor is A, breastfeeding beyond a year of age, B, drinking apple juice from a bottle in bed, C, drinking apple juice from a bottle with lunch, D, drinking apple juice from a cup with lunch, and E, drinking formula from a bottle between meals. Bottle in bed. Okay. So are any of those other answers close, or could they be right? So between meals, so what would be a risk between meals? If you have to, I think you have to clarify E to make it greater risk.
Just more frequent.
Okay, it would be more frequent. But what is the real issue with caries and the risk of caries?
You don't wash your stuff off.
Okay, so it's contact of sugar with the tooth, and the longer it's in contact with the tooth, the greater the risk. So a child who has a bottle, who walks around all day holding their bottle and sipping on it, is different than the child who drinks a bottle in 10 minutes and puts it away. That's really not a whole lot different, I think, than drinking from a cup, or especially those straw cups. I mean, those are probably very similar. So E, I can imagine it being an issue if you were drinking a bottle and sipping on it for long periods of time. What is the other issue with caries besides contact?
Consistency.
Consistency, but there's another issue that's specific, and nighttime is partly about contact, because you fall asleep and it's still in your mouth and you have increased contact, but it is also about some of the chemistry, the fact that there's decreased saliva flow, there's a more acidic pH at night. So it's sort of the perfect scenario is a bottle at nighttime increases contact, and also the chemistry allows for caries formation. So it's a combination of those two. Question, so I also want to make sure we talk about A. So can you get caries from breastfeeding? Yes. Yes, exactly. So you will hear people who want to call caries baby bottle caries, and yes, most commonly it's bottles, but it also can be breastfeeding. So a baby who is nursing all night long really isn't lots different than a baby who is drinking a bottle all night long, if they fall asleep with the breast in their mouth. Question 10 is, a 14-month-old who is breastfed with bottle supplementation presents with early evidence of dental caries. Of the following, the most appropriate practice to disrupt this process is discontinue bottle feeding except for juice, encourage brushing teeth with fluoride-containing toothpaste, switch from formula to whole milk for bottle feeding, use bottled water to prepare formula. 14 months, stop the bottle.
Except for juice,
Except for juice.
Yeah, obviously.
Right.
Of course. So back to that same point, the bottle feeding is definitely a risk. I think you have to prioritize your risks. I think the issue I try to make, we'll talk about prevention in a second, the issue I try to make is, again, what are the greatest risks? And the greatest risk is a nighttime bottle with increased contact. If you are drinking a bottle, again, for 10-15 minutes, you get your teeth brushed or cleaned and you go to bed, is that any different than a sippy cup? I don't think that it is. Yes, it would be nice to get rid of the bottle, because the longer the bottle is around, the longer the bottle is around, because it becomes a habit, like many other things. Really, I think you have to sort of prioritize those risks. So getting rid of bedtime bottles and nighttime bottles for sure. Any bottle at nighttime that has sugar in it, plain water is fine, but anything that has sugar in it at nighttime needs to go away. So what about prevention? What do we tell parents to try to get rid of or decrease the bottle so we don't get to a 14-month-old who's drinking a bottle? So when do we get rid of the bottle? I'm sorry, what was that? 9 months? A year? So when do you first start talking about it? 9 months? So I back it up a little bit, and I go back to when I first talk about juice. And the first thing I try to talk about is not putting juice in a bottle. Putting juice in a cup, and one of the reasons for juice in a cup is because most kids won't drink a whole lot of juice out of a cup at 6 months of age. They don't need a whole lot of juice, so it decreases how much juice they drink. But part of what I think happens is that kids end up becoming attached to not just the bottle, but the flavors that go along with that. So I try not to put anything in a bottle that they're going to drink when they're older. So formula in a bottle, and juice in a cup, and whole milk in a cup. So if you make that transition at 12 months, and you start that in their mind at 6 months, that juice is in a cup, and then when we get to 12 months, milk is going to be in a cup, and formula and a bottle are going to go away at the same time. If you do that at 12 months, I think it's easier than delaying it, because then it becomes a bit of a habit. And then this is just a summary of most of what we talked about already. So the enamel of the primary teeth is thinner and more easily injured. Maxillary incisors, you've all seen this in clinic, I'm sure. Maxillary incisors are much more common than mandibular teeth. Mandibular teeth usually come next. And this is just to remind us that yes, breastfeeding can cause caries. Question 4 is a 7-year-old boy lives in a community with a water supply that contains 0.9 parts per million of fluoride. He has had 2 caries in his primary lower molars filled with amalgam. His school offers a fluoride rinse program. His mother asks your opinion about allowing her son to participate. She has a past dental history of many caries and restorations. So the best recommendation is no participation in the program, but a prescription for fluoride. B is no participation in the program and fluoride at 1 milligram per day. No participation in the program, period. D is participate in the program but no fluoride, and E, participate in the program and get fluoride. So basically you can split those 2 decisions out. Should he get the fluoride rinse? Yes. Should he get systemic fluoride? No. So that gives you really nothing but D. Should make it easy. So remember that, I'll show this slide. We all know this because we do this in clinic, but supplementing fluoride, we're going to talk about the controversy a little bit, but supplementing with systemic fluoride beginning at 6 months if there is not fluoride in your water. And topical fluoride is better than systemic fluoride, so you definitely want him to participate in the fluoride rinse program. 11 is related, and 11 is aim mother brings in her 6-month-old child for a health supervision visit. She explains that the family just moved from a rural area where they obtained their water from a private well. In the past, she needed to give supplemental fluoride to her child beginning at 6 months and wonders if this is necessary for this child. Of the following, you're most likely to reply that A, all children should receive fluoride supplementation starting at birth. B, children should not be supplemented if bottled drinking water is used. C, fluoride 0.5 milligram per day should begin at 6 months if there is less than 0.3 parts per million in community water. D, once the baby's teeth erupt, fluoridated toothpaste will be sufficient. And E, supplementation may stop when the child's deciduous teeth begin to fall out. C. So fluoride beginning at 6 months of 0.25. You guys all do this in clinic because I think there's only one town in Camden County that has fluoride in the water, and that's Sicklerville. So really, you can probably stop looking if they live in Camden County. And then outside of that, I always have to look still. There's still some towns that I don't realize have fluoride. So the issue that comes up, and I'm curious about Mike's 2 cents about this. So the issue is, how long do you continue fluoride? That I think we should talk about, because on the one hand, underuse of fluoride certainly leads to caries. On the other hand, overuse of fluoride can lead to fluorosis. And balancing those, and if you look at the official recommendations, you guys all know the beginning, because we start everybody in clinic. If you have less than 0.3 part per million, you get 0.25 until you're 3, 0.5 from 3 to 6, and 1 milligram from 6 to 16 is the official recommendation for fluoride supplementation. I don't think a lot of people follow the 6 to 16. I think some of that is because of the concern about fluorosis and what excess fluoride can do to the teeth. I can tell you that my kids didn't get this, and we have well water. We definitely don't have fluoride in our water, and I think the way my group looks at this is, since topical fluoride is more important than systemic fluoride, once you get to the point that you are getting regular visits with a dentist and you're getting topical fluoride applications, and you have good dental care, most of those kids, we stop the fluoride at that point, and we have them talk it over with the dentist. So I'm going to ask a dentist.
Well, I agree. I rarely prescribe systemic fluoride. You see fluorosis a lot, usually in the teeth that come in first, the adult teeth. So you see it in the anterior incisors and also in the posterior 6-year molars. But once the teeth are in, exactly just like that. And sometimes it'll be like brown to yellow. But as long as they have regular visits, topical fluoride is the best. If they don't have good hygiene or they have their high susceptibility to caries, then we prescribe like a higher fluoride toothpaste that they can brush with at nighttime. So we don't prescribe systemic fluoride.
The other issue you have to remember with preventing fluorosis is, so we didn't talk about really routine care of the teeth once they erupt, but cleaning the teeth either with a cloth or with a toothbrush without really, in the beginning, really probably not any toothpaste, or if toothpaste less than 3, really a smear. I mean, really, just enough to flavor the toothbrush, I think.
You say pea size.
Yeah, I even go less than, that's a dab. a really smear of a pea.
I have a question, and I did an educational prescription about this. So when you look at the AAP guidelines for fluoride supplementation, they talk about considering all sources of fluoride in patients' home before we supplement. So does that include brushing teeth twice a day? Because obviously, like, typical fluoride is best. Should that be brushing teeth twice a day compared to fluoride in drinking water? Should you like compare both before we decide to supplement?
So I don't include those, if you remember how much toothpaste you're using, because you have to remember that any toothpaste you use in somebody less than 3 is gonna be swallowed. So that will be fluoride, ingested. So that's why only a teeny tiny amount. But there can be fluoride in many prepared beverages that you purchase. The flavored beverages often have fluoride in them. So if you're drinking a lot of those, you're getting systemic fluoride, and you're getting fluoride in other drinks. You outside of your house. All of that. I think you have to factor in there. I don't say if you're brushing your teeth twice a day that you shouldn't get fluoride if you're in that less than 5-year-old group. It's really until you're having regular dental care, and I don't know what age you guys think about stopping it, until you have regular care. We usually say once you get to school, we stop the fluoride. Most of us do it for the less than 3-year-olds.
You stop systemic fluoride?
We usually stop systemic fluoride as, and I think I may usually feel a little bit differently about this depending on how good their dental care is. If I'm convinced the parents are taking them to the dentist regularly, then I may stop sooner and say, ask your dentist. But especially in our Camden population, I think I tend to want to continue the fluoride until at least school age.
Yeah, it's different in Camden compared to Philadelphia, because Philadelphia has really high fluoride levels in water.
Right.
So you see a lot of fluorosis. So that's why we don't prescribe it.
Right. Yeah, I think I don't remember what Philadelphia's levels are, but right, it's definitely above 0.6, so you do not need to supplement with fluoride. Sure.
Fluorosis reversible or just skin?
It's not reversible.
You can cover it up, I
You
assume,
can
right?
cover it up, yeah, you can remove that tooth structure, put a crown on it, but you can't reverse it. You could try whitening, but sometimes it's brown, and it's intrinsic as well, so you have to cover it. Veneers or a crown or white filling. Remove the colored tooth structure.
All right, next is one of my favorite topics. Question 3 is, you're examining a healthy 3-year-old boy. His mother reports that he still sucks his thumb. Of the following, the most appropriate management is A, no treatment before 4 to 6. D, an orthodontic appliance. C, physical barrier to thumb sucking such as mittens. D, psychological counseling. E, topical aversive taste treatment applied to thumb.
Also, I don't want to just swat your hand away when you try.
So why do kids suck their thumb? For comfort. And usually it starts in infancy, and we'll talk about pacifiers versus thumbs, but usually it is for comfort. Many babies, and some more than others, have a need to have some non-nutritive sucking to soothe themselves. That can be a thumb, that can be a pacifier, and the way I always point it out to parents is that if you let the child choose, the one they have access to is the thumb. So I think that the parent can make a choice of which they prefer. So which is better, thumbs and pacifiers? So what's the plus to a thumb?
It's right there.
It's there. And if you think about why they're doing it because they want to soothe themselves so they can determine when they use it.
Infections with actually using your thumb, say there's a cut, and we've had this happen.
Okay, so there are some of the negatives to thumbs are that you can get complications, you can get calluses, thumb sucking eczema, you can get infections, herpetic whitlows, if you had oral herpes. So there are definitely some negatives. And the fact that it's available. The parent doesn't have to get up in the middle of the night to put the thumb back in. The child can do it themselves. But one of the negatives is that it's available. You can swat it away, but it's still there.
You can't cut it off.
No, you really, then they would just move to a finger. So the pacifier is disposable. You can change them out, and they can be cleaned a little bit better than the thumb.
They are disposable in theory. Yeah, I mean, it's really hard.
We'll talk about
It's
that.
hard.
We'll talk about
Yes,
that.
they are disposable.
So you can remove them easier, but the availability issue is the opposite, is that you can't, the parent has to get up in the middle of the night and put it back in until the child is old enough to figure out how to do that themselves. But it is definitely easier to get rid of in a sense because you can take it away. Having had, I always have to give my disclaimer that my daughter was at least 4, and my son was, I think, pushing 4 when they were sucking pacifiers still at that age. My daughter was really psycho about it. She had, I called it a bouquet of pacifiers, because it was also, she had to have her little collection, and when she went to bed, and if one was missing, God forbid, you could go find it, and she always had to have one to smell. Which is really gross, smell at the same time that she sucked one. So it was all about comfort and making her feel better.
Does she know you're telling us this?
Oh, absolutely. She knows I talk
We're
about
never
her.
gonna see her.
I could call her up. She would love
Put
it.
her on speaker.
Put her on speaker. So how did I get rid of that? Paul said it's really hard. So obviously it wasn't easy because she was still 4. So how did you finally get rid of that? You get to a point that you reason with them. They're doing it for comfort, but at some point it eventually becomes a crutch. She was also the child who needed to be pushed into toilet training because she just didn't like change, I guess. So eventually we convinced her to get rid of her pacifier. So one of the other issues that Mike sees is that it causes malocclusion, and yes, she did have braces, but they didn't label these as either, but I typically think of thumbs causing more of this issue and pacifiers more of this. That thumbs are, we didn't talk about that, but thumbs are more rigid than pacifiers, so they tend to cause more issues with malocclusion than pacifiers do. So it's hard. Again, a pacifier is easier to take away and easier to stop than a thumb. I tell parents you have to make a decision, and if you don't make a decision, the child will make a decision. And my vote is for pacifiers because I think kids who end up being thumb suckers can sometimes be adolescents who are thumb suckers.
Parents.
I've seen
Yeah.
parents.
I was telling you that because in the parents
For kids that are that have special needs or anything like that, would you consider doing C, the physical barrier? Because I mean we do see kids in clinic that are like 6-7 years old, they still suck their thumbs, but they're also like special needs kids. Like I see one or two Down syndrome kids in clinic that have like the thumb sucking eczema because they just keep doing it for comfort.
I don't. I don't because you can put it there, but they're going to get old enough and smart enough to take it off. And you're also interfering with it's what they use to soothe themselves. Unless you replace it with something else that calms them, a blanket, a stuffed animal, then so I try to look at it from the developmental perspective that they're trying to make themselves, they're trying to comfort themselves. So certainly putting hot pepper on their thumb, I think, is cruel. They're just going to move to something else. My daughter, when we got to the point that we were trying to take away her pacifier, she started to put her fingers in her mouth and her thumbs in her mouth to substitute. And you eventually have to sort of backed off a little bit and then pushed a little bit more later.
So how'd you guys eventually fix it?
We convinced her to just do it. I think part of it was she had a 2-year-old brother who is more willing to give his up than her, and they did it together.
So the reason why not B is because it's less than 4 years old?
Partly because they're expensive and partly because it's usually gonna get better when they're a little older. I mean, within a year, hopefully you can get them to stop.
You wouldn't do B until they're older. Like if it's like a 9-year-old, like the bottom picture here, that patient's probably 9, 8 or 9. That's like bad. That habit's pretty set in. They're not gonna stop. So you do that as a more permanent fix. It's in there. That it's a constant reminder when they put their thumb in. But usually you try. I've actually recommended parents that if the kid's like 7, 6 or 7, they're still sucking their thumb. Mostly they do it at nighttime when they sleep. So I'll say duct tape a sock or even a mitten on their hand. And that's what.
It's a reminder.
Or you can put like an ace bandage, wrap an ace bandage from shoulders to wrist, so it keeps straight
So when I think of doing those things and not recommending them, I'm thinking of the 3-year-old. But a 7-year-old, I think that's fair. Because it really is a reminder. Right, so that was my summary. So any questions? Nope. Excellent. We're now going to do part 2. And I'm going to move to the usual side of the room. And I'm going to explain what I'm doing. Because everybody's like, what the heck?